Hello, 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 everyone. You're watching my Upper West Side cam. This is Sree's daily global COVID-19 show, and my name is Sree Sreenivasan, and I'm absolutely delighted to have you here with us on this journey as we learn all about COVID-19 crisis from different angles. Today is our Ask the Doctors session. We've done several of these. We've had a dozen doctors. This is show number 40. That means we've been on lockdown in New York for 40 straight days. I've been on the air 40 straight days, all because of you and your support and your love. I'm so grateful to all of you for being here. Please tag your friends. Please hit share right now. I'll say that to my guests also. Find me on Facebook and please share the post so that your friends can join us, friends and family. We're talking to doctors in 2 different countries. So it's going to be extra, extra special. We're going to talk to a doctor in Germany, and we're going to talk to a doctor in Stamford, Connecticut. And so let me just, first of all, say thank you all for being here. Thank you for being part of our show. This is the show that we are going to be hosting right now. We are going to meet Dr. Bernadette Ateghang from Heidelberg in Germany, and Dr. Scott Chudnoff, who's an OBGYN chair at Stamford Health. And they're both going to be here in just a moment. We're just going to check in on the camera outside so you can get a sense of what's going on outside. This is New York City. It's 7 p.m., which those of you who know, that means people are applauding for what's happening to our wonderful healthcare workers. So we'll just give it a few seconds so you can listen. It's just winding up now. So about 4 or 5 minutes of wonderful applause every day at 7 p.m. We're on the Upper West Side of New York, looking downtown, midtown, and into the distance is the World Trade Center. But what you're looking across, the tallest buildings you see closest to us, those are all the buildings from about 57th Street, what they call Billionaires Row, and that's what you're seeing there. So thank you so much for being here. Thank you for being part of this journey that I've been on for 40 straight days. When we started, we thought this would last a couple of days of my being live with you, but we're live on multiple platforms, and we have 2 great guests who have joined us. I'm so thrilled to be able to bring them to you in just a minute. First, please find me on Facebook and please hit share. If you find me on Twitter, hit share. Go on to YouTube and comment. Find me on LinkedIn and share. The whole idea is we want as many people in the world to learn from this show as possible. We've got great, accurate information from medical professionals, from expert scientists, not from trolls and fake information on the internet. And that's why I'm so proud that we are able to bring you these shows. I want to tell you what all we have done this week and what else is coming up as well. We did a Twitter tutorial yesterday, so you can go into my archives. The best way to find me is on my YouTube archives. Look for sreenet, find my YouTube archives, and please go ahead and subscribe so you can see that. So that was one of our shows. We are having a great show tomorrow because America's former ambassador to India, Richard Varma, will be with us. And Richard Varma is vice chairman of the Asia Group and a great expert on India-US relations, as well as Asia and South Asia. And so he's going to be with us tomorrow at 11 a.m. Eastern time, which is about 3 p.m. GMT, 8 a.m. Pacific time. So we try to mix this up with several different topics. Every day we're going live with these stories. We were on Sunday night with Tal Ben-Shahar, who taught the most popular class in the history of Harvard, 2 of them, about psychology, positivity, and he was with us for our every Sunday night positivity show. You have ideas for guests, please tell us. Please share their names. We'd love to have them. Sree@sree.net. I'm very easy to find. None of this would be possible without our 2 wonderful producers who I want to give a big shout out to, Vandana Menon, as well as Rose Horowitz. They're both live tweeting at Rose Horowitz and at Vandana Menon. Please do follow them. And I also want to say a big thank you to our sponsor, Girl Scouts of Greater New York. Help us donate 100,000 boxes of cookies to healthcare workers. Go right now to bit.ly/GSCookies1, bit.ly/gscookies1 and make a donation. Every box will go to a healthcare worker in New York. We'll get them things like, how about tagalongs? How about Samoas, Thin Mints? They get to have all those favorite cookies from us. So make sure you donate. Go to bit.ly/gscookies. You are doing 3 good things if you go and make a donation. You're supporting the Girl Scouts, you're supporting the healthcare workers, and you're supporting this little show. This ad has been paid for by a third-party donor, a very generous, anonymous third-party donor, and therefore no money is being taken away from the Girl Scouts. So please make a donation. Several of you told me you made donations. I was so thrilled to hear that. Please make a donation. And if you would like, we'd like to have your ad on our show. Look how inexpensive these ads are. They're so cheap. We would love to have your support. This money will go to help pay for our producers and get you better production quality and production values. My email is sree@sree.net. Please email me. Please get in touch. Speakers, ideas, guests, themes. We want all of it. We're very greedy on this show. And we are so delighted to now bring you our 2 guests. Let me say hi to all the way in Heidelberg. Dr. Bernadette Ateghang is here. Hello. Let me just, how are you, Doc? Thank you so much for being here.
And you?
Yes, thank you. It's very late for you. It is 7 p.m. here. It is 1 a.m. there.
Yes.
Yeah, look at the lighting on you. You look like you're in the look at my
I sleep late. You know, we have been indoors. We are on lock-in store for the past 5 weeks also. So my time is a little bit shifted. So I do a lot of reading in the evening and try to correct certain things. So that's why I could accept to stay up this time. But it's quite.
But I have to admire your energy level at this time and the fact that you are with us. Thank you very much. Let's also bring in our doctor friend who is watching us and being with us from Connecticut. He is the head of OBGYN, the chair at Stamford Health. Let's bring on Dr. Scott Chudnoff. Hi, Doc.
Hi, Sree. How are you?
Great to have you here with us. We're not always going to be in such tight quarters. I'll give you a little wider shot in a minute. But tell us where you are, Doc.
So I work in Stamford, Connecticut at Stamford Health, and I'm the chairman of OBGYN there.
Terrific. We have so many questions already coming in. Please ask questions that our doctors can answer for you. You're going to hear from a freelance medical scientist and the head of OBGYN at Stamford Health Hospital. 2 very serious but fun and funny people. I know it. So we're also going to learn from Dr. Chudnoff how to make your own face masks. He made a wonderful video that we will be sharing as well. So let's just get some comments in from everybody here. People are tuning in. Jonathan Borstein is watching from the East Village. Look at his mask. He's got a good mask on. Neil Parik is watching from Springfield, Virginia. Hi, Neil. Neil produces our really big shows where we have clients and support, including our very big read-along, the New York Times read-along. We read the Sunday New York Times at 8:30 a.m. Eastern every Sunday for 5 years now, and we're live on Facebook, Twitter, YouTube, LinkedIn, etc. And this was our guest this past week, Dr. Judge Rosemary Aquilina. She's the judge who presided over the 2018 gymnastics scandal, the USA gymnastics scandal, and Neil was guest hosting and I was producing, and it was a very important show, a brave woman, wonderful woman. All of these folks you can find in my archives. Please go into my archives on YouTube. That's the easiest way to find it, and you will learn so much. So please join us there. Let's see who else is tuning in and saying hello. Jigger says, can you hear the cheers outside right now? We did, and we were able to show the camera, which is great. Tim says, hi, Dr. Sree. That would have been my mother's wish to be a doctor. We'll go with Professor Sree. Thank you. And Joe Pio is watching. Tim says, loves the purple branding. I should have worn a purple shirt. He's also saying hello to Neil. One of our Facebook group viewers is saying you're doing a great service in public education on COVID and social distancing, bringing in multiple experts. Great effort, which must have saved many lives. Thank you. That is so kind. The real heroes are our healthcare professionals who are doing so much for everybody. Neil is cheering for the Girl Scout cookies tagalogs. And Rose says, hi, everyone. There was a gorgeous rainbow tonight in Milford, Connecticut. Thanks for the shout out, Sri. Vandana Menon and I will be tweeting live. Let's ask the doctor where Milford is compared to Stamford, Connecticut.
A little bit north of us, but not too far.
Okay, and people are watching in Santa Clarita, California, which is awesome. And people are just so generous and so kind. Tag a friend right now, please. Hit share on your Facebook, your Twitter, retweet, so people can come and join us. Let's start with Bernadette. I asked her permission to call her Bernadette, and I'm going to call you with your permission, Scott. But we'll continue to share questions and comments. Ask anything is the answer that we want everybody to ask. But let me start with Bernadette. Please tell us where you are, how you are, and how the entire crisis has treated you. And then we'll get into some of the science behind everything.
Yes. No, I've been basically, we have our lock-in since 5 weeks now. So my son is in the 7th grade. They just resumed. Actually, today is the official school resumption. But so they are doing it online. Within the past 5 weeks, the schools have succeeded in instituting some sort of a Moodle for them. So I'm happy because on one side, it is, we understand we have to try to curb the disease progression, but on the other hand, we also want our kids to learn. And but my wish is that our healthcare professionals, they should not lose their lives by trying to protect us. And for that, I hope psychologically, anytime I feel I have to be down, I feel down, I look outside and I watch the TV, and I realize that there are many other people, like even when the post man or the ladies, they bring my package, I'm like, okay, now we have to sit in, but these folks have to go out and make sure we get what we need. And for that, I appreciate it.
Thank you so much. Let me tell folks a little bit more about you. You are a freelance medical scientist, originally from the southern Cameroon in Germany. And Dr. Ateghang is a biochemist who has always researched and worked at the cross-section between science and medicine. She's been working within the pharmaceutical industry as scientific expert in the areas of diabetes, pulmonology, and CVD. And Dr. Ateghang is serving as the medical scientist within the very long task force name, is a German Cameroonian Forum for Medical and Paramedical Sciences. Thank you so much for everything you're doing. For most of us, it'll be a shock that Germany is opening up already. How is that possible?
I think the things it is like, let me say, we are moving into the phase because over the past weeks they tested already how the attitude of the community, how the people respect the preventive measures, and so it was easy for us. When I go shopping, I know I always have to move into the supermarket with a shopping cart. I know I always have to respect that distance. So that has been propped over the weeks. So that is why they said, okay, maybe let us move into the next phase, bearing in mind that Angela Merkel is somebody who is very, very careful. And so, but somehow people have to keep moving, but without losing sight of the risk if we are not careful. So all depend upon us. This is a situation where they say, okay, our future lies actually on our own attitude. It lies within our own framework. So it is difficult to actually judge what is best. But I think since we have shown over the past weeks that we could respect certain measures, and we should remember the reproduction rate of the virus within Germany is now around 1. So it means one person is able to infect just one person. So that is what makes the virologists think, okay, maybe it is possible for us to start moving towards at least losing up a bit.
Thank you. Let me go to Dr. Chudnoff, who's here with us. Scott, thank you for being here. When you hear her describe that Germany is already opening up and we're just getting ready in many ways, how do you feel about that?
I think it's remarkable that they're already at that point where they're able to open up. When I consider what's been going on here, and where a lot of parts of the country are still haven't even had their surge yet in terms of the number of cases. So I think it's really remarkable that they're capable of starting to open up and be able to get more access to other places. But I have to say, when we look around here, the concern always is going to be that as we start to open and allow more social contact to occur, about whether we will see another spike as people get exposed again.
And that's something that we all have to worry about. So let me ask you, Dr. Chudnoff, tell us how you are doing, how's your family, and what's it like to be an OBGYN at this moment? Because one of the questions a lot of us were asking is, what is happening with the babies that are coming out? What's happening to heart attacks? What's happening to appendicitis, toothaches? We've tackled all those questions, but we haven't had an OBGYN live on our show. So we're especially curious about that part. But start with your family first.
So my family's doing great. We are like everyone else. I have 5 children, and we're home, and my wife and I, and it's been challenging, obviously, with homeschooling and now suddenly transitioning. But otherwise, though, we've adapted. Luckily, everybody in my family has remained healthy. We haven't had any exposures, including my extended family. So that's something which we're really very happy about. But at this point, we're hoping to keep things that way. We're hoping that we won't have any exposures, and I can tell you that it is stressful, though, for myself when you have to go to the hospital because of the fact of the risk. Not even so much of the exposure to myself, but as much as if I were to get exposed and then to bring it home to my family.
And that's the really scary part for so many of us. I do want to say, you said, like a lot of us, I have 5 kids. You meant you're at home with your 5 kids, but to me, I nearly fainted because it made it sound like I have 5 kids. I have 2 kids, 17-year-old twins. That's plenty. So how you're managing with 5, that's incredible. God bless you, sir. I know it's not easy. Tell us the age ranges, please.
My oldest is 18 and my youngest is 8.
And how is the 18-year-old doing? High school, senior, junior?
He's actually in his first year. He's actually studying abroad and is currently abroad right now.
Wow. So but he's staying by relatives. Okay, that's great. We have a very dear family friend whose son was in Italy, and they had to decide, leave him in Italy to study abroad or bring him home. And if you remember, at one time, Italy was worse than New York. And so they brought him home, and then New York became much worse. So there's no right or wrong answer. As long as you're with family and you're with loved ones and you're safe, that's the important thing.
Yeah, that's the important.
Yeah. Please, Dr. Bernadette, tell us a little bit about what you're observing about America. I know you watch a lot of, not just this show, but you watch a lot of news. What is the difference between what America is doing and what Germany is doing? And I think it starts with Angela Merkel right at the top.
Yes, the thing is, the moment things we were experiencing what was happening in Italy, and so it was easier for Germany to get ready because we had at least 2 to 3 weeks, and since we are neighbors to Italy, the government then decided to go to do that. What the key word is that aggressive testing, because they tested, isolated, and treated. So, and then they were testing those that had contacts to those that were already positive. So that aggressive rate of testing helped us to at least be able to maintain the level within the capacity of the healthcare system. And if I have to compare the situation with how Germany embraced the fact that we are moving into a pandemic, and I compare it with some sort of a denial at the beginning, in January, in February, even up to beginning of March in the US, then I think it becomes apparent that the key thing that each community should do is to be able to provide those testing possibilities, because I doubt whether there are 2 countries that have done such broad-based tests testing like in Germany and isolating and treating the patients. That's why the healthcare system, and since our healthcare structure already, from infrastructure and the healthcare personnel, we have a very high capacity. So it is difficult to actually, it might take some time, but I hope with the reproduction rate now in Germany, if it continues this way, we certainly might go through this pandemic with a little bit positive note.
Thank you. And that's so hard to imagine. Positive note, we are seeing in this country, not just we've not beaten the curve yet or flattened the curve yet. We're still waiting for the apex in many places, but we're also seeing people fighting the protesting the social guidelines issued by the government. I love the headline in the New York Times, which said, President Trump, head of government, supports anti-government message. It just doesn't compute for so many people observing around the world. I have friends in India calling me and saying, how can this be possible? These are guidelines issued by the federal government that are being followed there. We have so many questions, so we want to come to them. Rajendra says, 2 questions. I've heard that doctors in Louisiana trying anything that might work are not intubating new patients with fluids since they feel slight dehydration may reduce the collection of fluid in the lungs. So I didn't get the full question, but I don't know if either of you have heard of that, of some experimenting with not intubation. Intubation means putting on ventilators. Can you talk about that? This is one of the side effects of when we're organizing here. People are posting in Facebook. So a suggestion to everybody, which we're all learning together, post shorter questions and comments, and then we can bring them to the doctor. So please go ahead, Scott.
So I think what it's probably referring to is that what we're seeing is that when patients get intubated, it becomes that much more difficult to actually remove them from the ventilator once they are intubated. And what we find is that if patients are capable of tolerating high flow oxygen rather than being intubated, obviously there are circumstances where a patient becomes so hypoxic, their oxygen levels are so low that we have no choice but to intubate them. But if it's possible to avoid intubation, we find that those patients can do very well. And what we've been seeing is that there's a larger window available and a larger amount of hypoxia that could be tolerated with these patients. What we also have seen is in terms of the amount of fluids to be given to patients and the managing the fluids. You know, historically, when people had a condition called ARDS, where there would be a similar process inside the lungs, the traditional school of thought is that we run these patients dry, we try to hold fluids low. And what more evidence is showing is that we need to change a little bit of that management. I think one of the amazing things about this pandemic is that on a day-by-day basis, we're learning something new on the appropriate way to manage patients that are suffering from this.
Thank you, folks. Let's get some more comments in here. Clara is watching from Turin in Italy, and we know Italy was in deep trouble, and they seem to have at least started flattening the curve. And there's so many sad stories. We talked to doctors live who are in Italy, including one who just came back from the front lines and then joined us for a conversation. And even Clara has been on 2 of these shows telling us what it's like in Italy day to day. When we had those calls, Dr. Chudnoff, with Italy, we were feeling a little bit confident in New York because we saw, wow, look at these poor Italians. How sad is their plight? I had no idea. Not only was America going to become the epicenter, New York City was going to become the epicenter. More cases than any other country at one point, apart from the United States. So when you look back, do you think we'll have a proper accounting of what happened?
I think that, the difficulty is that, I agree. I think when this was going on in Italy, we were all kind of looking at it and we're saying, can this happen here the same way? And it took everyone a little bit of time to really register the fact that this was going to be as bad, if not worse, than what actually was occurring there. And again, I think what was stark was the delay in us actually seeing the full impact of all of the cases. We were watching it on the news. We saw Italy. We saw, we were following medically all of the things that were going on there, and we were trying to get things prepared that would be appropriate. But I don't know whether we fully appreciated that we would be as big and as severe as what ultimately we're experiencing.
And that's so sad when we look back. As many of you know, of those who are watching, that South Korea and the United States got their first confirmed case on the same day. At one point, they had the same number, about 100 cases. And then when you look, you can see where America went and where South Korea went. And this says a lot about how we all prep and how we all need to work together. Let's look at some more comments. Mar Dixon says, as an American living in the UK, it's hard. I'm not sure I see my mom again, but mental health wise, I am lucky to be alive. Thank you, Mar, and I'm so sorry. I do hope you get to see your mom again. And she's saying it's Citizen Scientist Month. I'm not sure exactly what that is. Maybe Dr. Bernadette knows that in Europe. That might be something. Citizen scientist. I'm a little wary of citizen journalism sometimes, or citizen surgery, right? So, but citizen scientist, maybe it is being critically aware, and someone can Google and tell us what that is. The three of us don't know, but maybe a lot of people in our audience, and even Mar can tell us. By the way, Mar is an amazing expert on culture all over the world. The biggest museums work with Mar Dixon. She's an American living in Shropshire, England. Pradnya is watching from Springfield, Maryland. And Mar says, does the US understand this issue? So that's a question that we can think about. Mar says in UK, we stopped everything. And it certainly made a difference that the Prime Minister, who had been a little skeptical, Boris Johnson, was then paying much more attention, and the world paid more attention when he ended up not just sick and quarantined, but in the ICU. And we also saw an example where a fake news item went out saying he had passed away, and journalists were retweeting it, and all that stuff happened, which is a problem. Italy is nowhere near ready to reopen. Let's see what happens in 2 more weeks. And Mar says, my sister-in-law is having a baby Thursday via C-section, and her husband, her brother, is not allowed. So we'll come back to that point in a minute. I do want to ask Dr. Bernadette about this situation comparing the rest of Europe to Germany. And Germany is very famous for its ability to get people to follow science. We've seen that in so many cases of late. But talk about that. And if I may, as an immigrant yourself, you have seen that immigrants are treated in Germany, how they're treated and how you're doing. It's not always perfect in any country, but you may have seen that America has now announced that they are banning, temporarily suspending immigration to America. So can you talk about those things, please?
Without trying to be cheeky, I doubt whether any person wanted to travel now anywhere to America. But the thing is, regarding following rules, when I traveled to Germany, then I came to Berlin for my studies. I came in 97. And the first thing I noticed with the German community was, and it struck me a lot, because I realized that when people are moving up the stairs or down, they always move right. So I was somehow surprised coming from Cameroon. And that attitude of trying to play by the rule, and there are certain things that have been normed already, and people take it, at times you take it for granted. But since those things have been normed the way they are, it is easy then to implement certain decisions that might be difficult, but the moment you communicate them in a manner that the people do understand. And because now we have everybody saying, yes, our civil liberties have been somehow, we cannot live fully our civil liberties, but it is important to live after this pandemic. And that is why for me it was difficult. It has been difficult the past few days to watch the US news, the US media, because I was like, those people that are going out there demonstrating, what will happen in the next 3 weeks if they should fall sick? Who is going to cover the burden, the financial burden of that particular case? Because you are not only risking your own life, you are risking the life of those who decided to live by the law, and maybe by chance you meet somewhere in the shopping mall and they get infected. So with the system in Germany, the time when I came to Berlin, there were areas where we knew you have skinheads, I must not go there. But now, there was a period where you have a feeling of integration, everybody feels integrated. But since the refugee crisis in 2015, there is a shift, and I'm just afraid that maybe after this COVID-19 pandemic, there might be a further shift. But that means I also have my own role to play. I also have to try to create opportunities for people to meet and try to have a common sense of we went through the refugee crisis together, we went through the COVID pandemic together. So let us try to see how we can build our communities together. So it is that sense of, because now everybody is going out, like what happened now in New York. People go out 8 p.m. and clap. I'm leaving some out in the outskirts, so it is difficult for me to participate. But I would also like us to not just to clap to the nurses and the cleaners, but also try to make sure that at least they have the incomes that befit the job that they are doing. So those are the things that I believe with time. But the most important thing is everybody to get through this pandemic, and we are still at the beginning of our careers within the COVID-19 pandemic. Yeah.
Thank you. That's really helpful. And we have a question from Jamie Bedrin, who says, here's a question. We have a flu season, right? It's like from November to April in the United States. Will COVID-19 behave the same way? In other words, will there be a COVID season? And what is the season based on? And when is it based on when the virus started in the US? So Dr. Chudnoff, I know this is not exactly your field, but you're certainly reading the research and you're learning a lot about this along with so many of us.
I definitely think there is a concern that there could be a resurgence. I think that we're hearing a lot of that now from our infectious disease specialists. There's definitely the concern that, as any other flu, there are different seasons in which this can come and go. And I think one of the biggest fears we're starting to hear of now is that come the fall time, that we may start to see a resurgence of COVID again. I think one of the things to keep in mind is that the hope is, just like with the flu, where we try to get vaccination in place, that perhaps if we're able to get vaccination in place in a somewhat expeditious fashion, that we may be able to avoid many of the of that resurgence that may occur ultimately. But we have a lot of questions that we still don't have answered, like whether or not, even if you've been exposed, if that immunity is long lasting or something which will wear off.
Yeah, we're so scared of the second wave, third wave. You remember how Singapore got all the credit for doing such a great job, and now they're in lockdown because they're having that second wave. So that's certainly an issue. And we have so many questions about giving birth at this time. So as the chair of OBGYN at Stamford Hospital in Stamford, Connecticut, Doc, tell us what's going on with your patients, what's happening to pregnant mothers, newborns. One of the things I've heard in other hospitals perhaps is some babies were allowed to stay 3 to 4 days at the hospital with mom. They're now leaving in 1 to 2 days. So give us some stories and some insight, please. Thank you.
So we've taken a lot of efforts to try to mitigate many of the risks that might otherwise happen, both to the patients, to the baby, to the family members, and to our staff members as well that are caring for the patients. Certain measures such as everybody wearing a mask, limiting the amount of visitors that can be with the patient. I know that for our hospital, we are only allowing one visitor with the patient who has to stay with the patient in the room. And we've instituted a policy of testing all patients who are being admitted for delivery in order to be able to early identify a patient, because what was seen in many of the data out there was that there were a lot of patients who had COVID who were coming into labor and delivery and may have been asymptomatic on arrival and then developed symptoms once they were on the labor floor. So these are some of the measures that have been in play that we're doing in trying to mitigate some of the impact. But obviously, we're going to have patients who are COVID positive, who are going to be coming in, who are on the floor. There's multiple reports now of some very sick patients who have gotten really ill once they have once they came into labor and delivery, there was a case series that came out from Colombia, which showed one patient who actually, while in labor, is when she first developed symptomatology. And we have cases of patients postpartum who were fine during labor and then suddenly developed symptoms. So a lot of measures that have been going into place. Things like also, how do we deal with the baby once the baby's born? If you have a COVID positive patient, what do we do with the baby? We don't want the baby to be exposed. You don't want to take the baby away from mom. It's really, and unfortunately, there's no playbook on this. So all of this is stuff that's constantly going on. I'll have to tell you, one of the nicest things that has happened is there is a regular conference call that goes on with all of the chairs of OBGYN throughout the entire country. Wow. And it's really a remarkable opportunity for everyone to share and pool their experiences. And we've also had opportunities to do this even on the international level, where we've been speaking to the doctors from Italy. We've been speaking to the doctors from China. We've been speaking to everyone who preceded us to give us some guidance as to what was working for them.
Thank you, folks. I hope you can stick around for another 20, 25 minutes. Is that okay with both of you? For Dr. Chudnoff, he's here in the East Coast with me, so it's only about 7:40. But we should tell everybody, for Dr. Bernadette, it is 1:49 a.m. in Heidelberg. So thank you for both for being here. But I'm going to give her a little extra credit. Is that okay?
That's okay with me.
All right. So we're just going to reset here to tell everybody what they're watching. And we're also going to give both of you a moment to just catch your breath, and also maybe make sure you share the content with your friends. Tell them, text them, WhatsApp them, whatever it takes, folks. You are in a wonderful conversation right now with two amazing medical experts. We are so lucky that they are with us. We're lucky that the work they do on two continents. Dr. Bernadette Ateghang is with us. She's at Dr. Ateghang on Twitter. She is a medical scientist in Heidelberg, Germany. I'm so grateful to her for being here with us. And it's 1:40 a.m. How wonderful for us, and how bad for her sleep patterns. But thank you, Dr. Bernadette, for being here. We're also joined by Dr. Scott Chudnoff, who's here. He's the OB/GYN chair at Stamford Health in Stamford, Connecticut. And we're going to show you a fun video he made in a few minutes, and you'll get to enjoy that as well. And a reminder that this show is brought to you by our sponsors, and we have a wonderful, important sponsor that's connected to this topic. Girl Scouts of Greater New York are trying to donate 100,000 boxes of cookies to healthcare workers. Donate today, folks. Go to this link, bit.ly/gscookies1, gscookies1, bit.ly. This ad has been paid for by a third-party donor. So maybe you would like to do this. Maybe you don't have a nonprofit you want to support, but you have a wedding announcement. Maybe you have a birthday greeting, a holiday greeting, Mother's Day, all of that you can do. And you can help support this show by sponsoring us. And also we get the word out on something as good as this Girl Scout effort. And I'm going to tie this all together with Dr. Chudnoff in just a second. But thank you all for watching. And let's say hello again to our doctors. Dr. Scott Chudnoff is here. Doctor, how are you? And a freelance medical scientist and expert in everything from pulmonology to diabetes. Dr. Bernadette Ateghang is here. How are you, ma'am?
Fine. Thanks for having me once more.
Thank you. And everybody, please share your comments, ask your questions. This is your chance to connect with both of them. As we know, Germany has just opened, which is a pretty big deal. And we hope that gives us hope on our side here in New York, but not always the case. I had a wonderful comment earlier from a doctor, Dr. Dheeraj, who's watching in Florida, who says these shows are so important and we might be saving some lives. But these people like this and their colleagues who are saving lives, and we're so grateful to them for being here. Let's get some of the comments. And Rose Horowitz is tweeting at Rose31, Rose Horowitz 31, and Vandana_Menon. They're our producers. They're tweeting. Please go and follow them and share their tweets. Stefan says, "Bonjour, Dr. Ateghang." Oh, he's gone into French, and I will not be able to do that. You will have to translate. And somebody is making a joke and says Boris's biggest contribution to the efforts was bringing attention by getting sick. We wish that on no one. no matter what your political differences. He's a man with at least multiple children and family, so we wish him the very best. Marissa says, how can we help combat misinformation on social media? Great question. We'll go to, I like saying this, we'll go to Connecticut and then we go to Heidelberg. So let's go to Connecticut first.
I think that the best thing is for people to understand what are the reliable sources for information online. I think that a lot of times, we Google something, you could find pretty much any type of information out there, but it's not necessarily backed by any evidence or anything reliable. I think the most important thing is helping direct people to the appropriate sources from respectable agencies and healthcare institutions that have the information being made available. And of course, your own physician. A lot of docs are getting out on social media to try to get the word out about what's actually happening and to really dispel many of the myths. And to get appropriate information out there.
Thank you, doctor. And I've got to say, I talk to a lot of doctors and some of them take long answers. You're really good at those crisp answers. And I think that's good for all experts in communicating as crisply as possible. There's a beautiful comment from Stefan Kaplan who says, Dr. Chudnoff, your warm smile and your great insight alone made me feel better tonight. Thank you. What a great comment from Stefan. And I'm going to ask Bernadette, if she can translate what Stefan wrote here.
Bonjour, Dr. Bernadette. Merci pour votre participation. I don't know. I don't know whether it's perspective. So good morning, Dr. Ateghang. Thanks for your perspective or participation. Yeah. And thank you. Yeah,
that's really great. Before we go to Heidelberg to ask that question about misinformation, let's do something positive and let's show an incredible photo that Dr. Chudnoff just emailed me. We're going to put that on the screen right now, and he's going to explain what this is.
So I've been working with the Girl Scouts of Connecticut for some time on helping to create a girls' health app. And after speaking with them recently, they said to me, well, do you think that the hospital would be interested in some Girl Scout cookies? I go, I don't know who isn't interested in Girl Scout cookies. And the Girl Scouts of Connecticut pulled up with a van to the hospital with approximately 2,500 boxes of cookies to give to the healthcare workers. So it's incredible. It really is incredible. It's an incredible organization, and they really care.
Yeah, and who doesn't love cookies? They may not be the healthiest thing at all times, but what a great, refreshing break, right? And you all love the cookies. What is your favorite, by the way?
Thin Mints.
Thin Mints. Okay, very, very nice. Let's take that question about misinformation and social media to Dr. Ateghang. By the way, she's very active on Twitter, so you should be following her on Twitter. I'm going to get you her Twitter handle at Dr. Ateghang. So talk to us about that, please.
I'm sure 2 weeks ago, what Dr. Tedros from the World Health Organization tweeted, either 2 or 3 weeks ago, there was this tweet on we are not only suffering from the pandemic, we are also suffering from infodemic, because we have so many prophets, everybody trying to, everybody has a remedy, and everybody knows already what is happening. What I tell my people is we should, in Germany, I know we have the Robert Koch Institute, we have the World Health Organization, and also we have the Ministry of Health. Those are my sources for information. And if I have to go further, I also try to look at what the CDC is doing. So it is important to rely on the known authorities, the known institutions, because I think this lockdown has made people to be so creative. The level of creativity is huge, and the level of creativity has no limit when it comes to this coronavirus and COVID-19. So I just say let us limit to our known institutions and get the right information there.
Thank you. Great advice. I have a question that I want to just pull up again for Dr. Chudnoff. This was that comment from our friend Mar Dixon in England about, she was saying, I guess, about her sister-in-law maybe in the US or in Europe. Why would they the partner of the woman giving birth not be allowed? You said at least one person is allowed even in the middle of COVID, right? Why in some cases are they not allowing the partner?
So the concern we have, particularly with the C-section, is if a patient needs to be intubated. The biggest concern for transmission of COVID is if there's an aerosolizing procedure where the virus can be exhaled in a significant fashion through something done in the respiratory tract. And an intubation is one of those circumstances where that risk definitely does exist. So in circumstances, particularly if the patient is COVID positive or if the partner may have had an exposure, those are individuals that we're really trying to keep out of the room, out of the floor, both to avoid contamination to them as well as potential contamination to the patient or to the newborn baby. A lot of hospitals have different policies. Some hospitals have moved towards having no visitors present at all for any patient that's in labor. Some have moved that they only don't permit them if the patient is COVID positive, and some have relatively unrestricted policies, although most hospitals at this point have limited it significantly to who could be there. Like anything, it's a matter of numbers. The more people present, the higher the risk of contagion.
And I remember with my twins, twins are considered high risk for any age mother. One of the joys of my life was to be there. And I had to be filming, Doc, because I would have fainted otherwise. So I was looking through the camera. It was a way to stay awake and not fainting. But think that might be, or a father or a partner is not allowed to be with his or her partner when she is giving birth is so hard to even imagine. And there's a bookend to this, isn't there, to both of you? We're reading about deaths by senior citizens and others who are dying alone, and no one's able to go to the funeral. I had somebody I know, his grandmother died, and the grandfather's in the hospital already in a separate situation with COVID-19, and he doesn't know that the partner has died, and nobody's able to go to the funeral. So that bookending with the children, the newborn and the elderly, so sad to see. I want to give a shout out to so many people commenting and participating. Thank you. My father, by the way, is watching from India in Kerala. I don't know if either of you have been to Kerala, but India is getting a lot of props, as they say, for doing well so far. We don't know, and we hope that India does well. But all of these countries where it's seen that they're following what's happening in other countries, we're hoping that they will stay safe. And we, of course, don't know. Rose Horowitz says she seconds Thin Mints as the Girl Scout cookie favorite. So we like that very much. Marissa, thanks you both for your answer to her question, which is so great that you were able to answer her. So please continue to post your questions. I'm going to show to everyone a chart, the famous FT chart, which everybody has seen. This is about the bending of the curve, or what the curves look like. So this is today's chart, folks. And I'm going to ask each of you to comment. I'm just going to point out a couple of things, and then I'll ask Dr. Bernadette and then Dr. Scott to respond here. You're seeing, this is the famous chart, right? Everyone's seen it. Look at China, and we'll park China for a minute because of issues around where the data is and things like that. But look at South Korea in blue towards the bottom. Look at Japan. Look at Australia after all the crises it went through the fires, and look where it is today. Look at India. India is still growing, but still in the middle of the pack. Brazil, we have a president who lies and tells their people that the information given by the doctors is wrong, and he fired his health minister. And there you see Germany already on the slope down. And then look at the United States up there, Italy up there, UK up there. So first, Dr. Bernadette Ateghang, I'm going to ask you for your thoughts about this chart.
About this chart, for me personally, the only thing I know that is certain for China is the virus originated in Wuhan. So now, whether all of the cases are being reported might be difficult. But what we notice is, apart from Italy was at the beginning. So it is difficult to judge whether Italy could have learned a particular lesson, because the cases in Italy, they're skyrocketed, while the situation was not very clear from China. But China provided the World Organization everybody with the rightful information. Maybe the case with Italy and Spain might have been different. But for me, what is actually difficult to understand is why, after all of us witnessed what was happening in Italy, why the situation, especially with the UK and the US, is quite indicative. When we have leaders who do not believe neither in the science nor in their own experts. And it is very difficult to apprehend. And the other thing is, most in Australia, or most countries where they decided early enough to go into lockdown or to do the aggressive testing, we see that they could at least try flatten the curve earlier. So I actually appreciate what we are getting now in Germany, and I hope that the trend in Spain, in Italy, and in Greece, because the situation in Southern Europe is actually, I see that the trend is also going downward, and even UK is also going. It's an indication. So, but it is somehow we can read the political mindset of some of the world leaders from this map, although we are talking of the coronavirus. Yeah.
Thank you. Thank you so much. Dr. Chudnoff, your thoughts on this map or chart?
I hate the fact that to say U.S. is number one, but you could see how many cases they have and how rapidly it rose. And I think that it's obviously concerning, the fact that it is so high, but also I think that it is somewhat indicative of the demographic and the overall structure within the country, and as it pertains to travel and when social distancing really became effective within the country. It's only within the past several weeks that we've really started to institute many of the factors that have been effective in trying to slow things down. And we're starting to see that impact already. But you could see with other countries where they were much more aggressive, they were integrating testing quicker, they were integrating better social distancing and isolation processes, that their curves went much flatter, much quicker than what we've experienced here in the U.S.
All right. We have a few minutes left with our doctors. Please ask them anything. They're so generous with their time. A reminder, it's almost 8 p.m. for Scott, and it's almost 2 a.m. for Bernadette. She looks like she's ready to keep going, which is, I worry about that. Isn't it true that you advise everybody, Scott, that everyone should get more rest and relaxation?
You got to take care of yourself. That's the most important thing.
Isn't that what they're saying to American patients? They're saying, don't become a patient, right? The best thing you can do is not show up with, a heart attack and things like that. If you can.
And it's actually fascinating. I know you mentioned that on some of the other shows that you've already spoken about, the fact of how the rates of heart attacks and strokes here in the U.S. have declined over the past several weeks of this pandemic here. It's actually was a. I remember when I had my first patient that was in the ICU, and I was talking to the intensivist, and they were saying how they don't understand. They didn't have a stroke come in for 5 days, which was basically unheard of in terms of what our normal volume is.
Yeah, we have a little complicated question, so if you could bear with me. Cecilia says, and it's going to take up the whole screen, so watch. Cecilia says, air conditioner vent questions like during Legionnaire's disease, when people were getting sick from droplets of water dropping on people as they passed below on the street. Did I dream that in the 70s and 80s in my apartment building? If the AC in my window faces a shaft that faces the AC of a neighboring building, could we both have get COVID? I mean, she's asking, is there passage? Are there things where it passes like that? And Legionnaire's disease is something that we have seen in New York in the water tanks that a lot of Manhattan buildings you've seen have those water tanks. And if they're not cleaned properly, there can be situations of disease being passed on. But do you know anything about this kind of droplets of water from air conditioning from a victim's or a patient's apartment? Do either of you know this?
I'm not familiar of any cases like that. I think that, I think that, we're, like I said, we're still learning.
Yeah.
So is there a potential plausibility for something like that? Perhaps. Yeah. Is it likely? It's unlikely, given the fact that usually it's through the aerosolization of it. So if you were breathing in those droplets, that might be more the case. But it merely dripping on you is probably less likely to cause a problem.
And may I ask a naive question about intubation? What is that process exactly, and is it? To me, when I hear intubation, it sounds very aggressive. When I hear ventilator, it sounds like an oxygen mask. Can you explain the two to me, please?
Absolutely. So intubation is the process of where we place a breathing tube into the person's down their throat and into their lungs in order to be able to create a way for us to be able to push air in and out of the lungs. A ventilator is the machine which actually controls the flow of air through that tube. So in order to be on a ventilator, you are intubated. The tube is inside of you. So the process of intubation is placement of that tube. The process of ventilation is how the air is the machine that's used to move the air in and out of the tube.
It sounds painful and very serious, right? Because it is invasive.
Well, usually patients who are intubated and ventilated are sedated significantly. They're essentially asleep. I could tell you that with pregnant patients, cases of where somebody may have gone down very quickly and needed to be intubated, and then frequently what we need to do if somebody does need intubation and ventilation, depending on where they are in the pregnancy, we may have to do an emergency cesarean section. And it is possible, there have been plenty of cases now where patients have actually been delivered, but they were asleep from before and asleep for weeks afterwards, not even knowing that they had a child yet.
Wow. And in those cases, I mean, some of these are anecdotal, right? But they were okay when they come out?
Yeah, I mean, in most of the cases that I have seen so far, the patients have pulled through. Some of them, though, for fairly prolonged courses, where they could be, there's lots of case reports that are out there now that we talk amongst ourselves about what's been going on. We've had very good experiences so far, despite the prolonged course for some of these patients. But overall, the vast, almost all of these patients are on the mend, if you will.
Okay, well, I'm so glad to hear that, and thank you for clearing that up. This is one of the things that us lay people have no idea, right? Ventilator sounds harmless versus intubation sounds harmful, but they're both trying to help patients, and that's the main thing. Let's go to Bernadette, Dr. Ateghang on Twitter. Please follow her and follow Dr. Chudnoff on Twitter. We need to get him a little more active, don't we, Doc? You got to get a little more active on Twitter. Well, we have a great friend, Haim Haas. I'm sure he must have been pushing you to be doing more social yourself, isn't he?
He does all the time. Unfortunately, I'm usually pretty busy in the hospital. I haven't learned how to navigate the social media along with doing everything else.
Well, you and I can talk. Otherwise, you've got a great teacher and friend in him. So that's great. And we're going to show your video in just a minute. Before that, let's go to Bernadette in Heidelberg. What are some things that you wish you could talk to Donald Trump about? President Trump, if he was watching, which he's not, what would you say to him?
What I would say is he should provide the funds necessary for the state to at least be able to do that aggressive testing. Because if you don't test, you cannot isolate, and if you don't isolate, you cannot treat. So the cycle keeps going round. And the other thing is, there are moments where you have to quit politicking. There are moments where you just have to be the president of every other person, forget about the next election, but trying to make sure that when the polls are open, many people will still be alive to be able to cast their vote, no matter whom they are voting for. And also to provide the possibility for those that are not able to go to work because of the vulnerables should stay home, and they should also have those funds. So it is that thing of trying to make sure the healthcare personnel, they have to have their personal protective materials, and also the normal citizens who have the possibility of testing. And then, because when I know I'm positive, I might be able to know I don't want to infect the next 5 people and propagate the illness again. So for me, those are the 3 key things. He should support the governors to do their work, and then he should try to be the president of all Americans and forget about the elections for a moment, because he also needs people alive to go cast their vote.
Wow, that was an amazing analysis. Thank you for that. There was a reason the president used to be called the United States. You called the president the leader of the free world, and people used to look up to America for leadership. And by saying America first, America only, we have seen a shift in that the leadership of where this country is headed. But thank you very much. Let's go to Scott Chudnoff, who's the head of OBGYN at Stamford Hospital. Thank you so much for being here, both of you. We're going to show a little video that you made, not all of it because it's 5 minutes long, but tell us the origin of it and how it works. We're just going to show that to you, and then I'll turn down the volume and we'll fast forward, and then you'll start speaking if that's okay. So let's take a look at protecting providers. Learn how to make face shields.
So essentially what ended up happening was that there was a significant issue relating to personal protective equipment, PPE. And one of the critical pieces is something called a face shield. And I realized that this is something that probably could be made relatively easily. It didn't really require all that much work in order to make something that was the equivalent of it. I was actually sitting on the floor. I put on my face shield and I'm looking at it and going, this looks just like a binding cover that I had done for a report that I made about a month earlier. And I was like, I wonder if this could be made. And sure enough, I went to the Home Depot, picked up some weather stripping, went to Staples and picked up my binding covers. And I was like, all I need is something to wrap it around, and it looks nearly identical to the ones that we were buying commercially. And it made a huge difference. You know, you can see it's really very simple supplies. The whole thing takes about 30 seconds to actually make. And I can tell you that I've gotten messages from people from all over the country who have used this, people who've made it, brought it to their local EMTs, brought it to their local hospitals, and it's being used by providers, and it's helping to protect them.
Oh, wow. Congratulations. Thank you for doing that. We hear a lot about these masks. So tell us the difference, how this fits in with both.
So the difference between a face shield and a face mask. Face mask is meant to prevent the respiratory droplets that you're exhaling. You need an actual higher respirator, like an N95 mask, to prevent the aerosolized virus from contaminating yourself. However, one of the problems you have when you're seeing a patient is if you're sitting in close range to them, they may cough or sneeze, and those droplets, even though you're wearing the mask, gets into your face. It can get into your eyes. It can still soak through the mask. This helps to protect the face masks as well as to help protect the whole face from the droplets that could potentially arise and cause you to get infected.
It's great that you were able to share that. Thank you. Thank you, Doc. That was very cool. How did you make that video? Did you have help from your 5 children?
Actually, a special shout out in particular to my daughter, Abigail, who is my social media consult when Chaim's not around, and was able to help. She filmed, produced, directed. My other kids who were there also helping, making sure it looked decent, since their experience with videos is much more than mine.
Right. And well, please say hi to your kids and thank them on behalf of thousands of people who have seen it. It's got almost 10,000 views. And we will share it as well in our Facebook and other channels. I'm just so happy to learn about that. And it shows that people are trying everything, right? And there will be some good that comes out of it. Dr. Chudnoff just told us that one of the things he's doing is they're hosting global and national conference calls between OBGYN chairs and senior faculty and doctors. Isn't that a great thing that comes out of this? So that when there are advances in OBGYN technology, they can be shared. When there are questions, when there's a next crisis, we can really benefit from that. So thank you for being part of that change. Let me ask Bernadette, Dr. Ateghang, she's great on Twitter. You must follow her. She's in Heidelberg right now. What are some things that you are hopeful about? Because I will ask you both this question. What are some things that give you hope as we end our Tuesday night in New York and starting Wednesday in parts of the world?
Well, I am quite hopeful, noticing that many people have come to realize that there is no limit to who is actually at risk. Everybody is at risk. So everybody is trying as much as they can to stay alive. So staying alive, staying safe, and try and do everything to assist those that are helping us to stay alive. That means the post, those that are cleaning the streets, those the healthcare personnel, the nurses, the medical doctors. We heard from Scott what the expectant mothers are going through. So I just feel with all of this knowledge that I'm hopeful that the international community, they are going to pull in together and solve this problem globally, leaving that nationalistic tendency and think more in a multilateral manner.
And what do you think it will take for us to get there? And can you talk about the WHO? Why is it important? Even if you have any questions about some of its decisions, why is it still important? America is cutting off its funding now.
The thing with, like most of the multilateral institutions, they are not that independent. So autocrats can always misuse such institutions. But the World Health Organization, no matter how much mistake they might make, without the World Health Organization, the level of misinformation would have been worse. So at least with the World Health Organization, we have one coordinating point. We should not forget that the world is not only facing the COVID-19 pandemic. We have in Africa, we have in the Central African Republic, measles, issues of measles. We have problems of Ebola, hopefully, and then we have a problem of polio. And the moment people become skeptic, remember at one point in time, we actually thought polio has been eradicated. But the moment people think it is, there is something wrong with vaccinating, there is something wrong with institutions like the World Health Organizations, then you also give extremists the room to say, no, we do not want our people to be vaccinated. Then all of a sudden, we are not fighting only COVID-19. We have tuberculosis, the emergence of tuberculosis and polio. So those are the things. You cannot fix the institution by quitting. You cannot fix the institution. It's the analogy of using the firefighter. When the Australia had the fire, no matter what the fire department, the mistakes, they are going to try to quench the fire, put off the fire, and then later on you go into that SWOT analysis and try to analyze what went wrong. Certainly many things went wrong at the beginning of this pandemic. Certainly China lied to us, but it is not the time to question China or the World Health Organization. When everything is settled, then we can go back to the drawing board and say, okay, who did what and who has to pay for what, because somebody certainly has to pay.
That is really great advice. Before we let you go, we are so grateful to you. Tell us about your son's first day of school. Talk about that, please.
Actually, I'm sitting opposite his school position now, and because the first, when we had the shutdown before the Easter vacation, there was no. At least they had some assignments to be doing. The teachers used to send some notes for them or some work for them. But now over the Easter holidays, the school knew that at the end, not everybody is going to go back to they're not going to be able to participate. So now we only the people that are the people that are within the examination classes are allowed to go to the school premises. So now they are doing actually the real homeschooling, and so they are doing it online. They have their Moodle platform, and so today he had his exercise. Yesterday, today is actually, yes, they had 2 days of schooling already, and we try as much as we can to make sure he follows the rhythm they were doing while they were doing the school at the premises, because they are not yet in that stage of doing video calls within his class, because he's still with the 7th grade. Yes.
Okay. Well, we are so grateful to you, Dr. Bernadette Ateghang. Please follow her on Twitter. She's at Dr. Ateghang on Twitter. It is 2:13 a.m. in Germany, and she is still awake. And Dr. Scott, you'd acknowledge that her lighting is better than both of ours, right?
Yes, it's actually impressive. I think she's got even more energy than both of us, too.
That's right. And I think she's in a studio of some kind. It's very impressive. Music studio.
Maybe since I'm down, and maybe the lighting in this room is different. But as I said, now I'm not going out, so I straight out when I sleep. Most often, because at times I follow your live sessions even up to 2 a.m. So
thank you so much. Dr. Chudnoff, I want to give you a chance to say goodbye. Give us some hope as you say goodbye.
I think the best hope I could give is really the idea of what I've been seeing. The amount of ingenuity and the amount of how much people have been chipping in to help. You know, you had mentioned about the fact the end of life of people not being able to be there, the beginning of life of people not being able to be there. And we had that issue in our hospital of what are we supposed to do? And I have to tell you that it's been incredible. Our IT team came together, put together an entire system of iPads in order to be able to allow those communications to take place for people that would not otherwise have access to them. And it's those types of things. People just saying, I see a problem, we're going to fix this, we're going to do it, we're going to be part of the solution rather than being part of the problem. And it really is, it's very inspirational. The things like what you're doing, the show that you're doing, getting the information out there, really, these are the things that are game changers. You ask the question, how do we get correct information out there? It's things like this, getting people who can give the right answers to people that really make a serious difference and are really going to impact things. And I have to tell you, as a healthcare provider on the front lines of this, every time that we do something that everyone participates in staying home and helping to avoid the spread of the virus, it really has a serious impact for us as well. Because what that means is that you care about us as much as we care about you.
Oh, that's so special. Can I ask you, without getting too sappy, does it give you extra energy to be bringing life into the world every day, all through this, as we see death around us?
I'll tell you, it's one of the most amazing things, because it gives you a sense of joy that other than the ICU and the emergency room, the only thing that keeps on going is the labor and delivery floor. And it really is, it's very nice that we see it. Our hospital has started a process that every time a patient gets out of the hospital who is COVID positive, they play music over the loudspeaker to let everybody celebrate together. And it really, it's things like that. You see these new babies coming into the world, and you realize, you know what, this is going to pass too.
Oh, that's amazing. And on a lighter note, may I ask, do you see a baby bump in the next 9 months? Is there going to be a boom?
I actually do anticipate it. I know it's been a debate out there. My call is we're going to see a bump. Okay. And on that note, on Friday at 8 p.m. Eastern time, we have the relationships columnist at the Wall Street Journal, Elizabeth Bernstein, and we also have the director of the Kinsey Institute to talk about love and relationships and baby making and non-baby making during COVID-19 on Friday, 8 p.m. Eastern on these channels. So I hope people tune in for that. Thank you both. I have no words to appreciate how much you've done for all of us, how much you've helped us. My dad is watching and says, listening to the doctors, we feel we shall overcome. Thank you.
He is in Kerala in India. I hope you will go and visit him when we can do those things down the road.
Yeah.
Thank you very much, Doctor. Thank you very much.
Thank you, Sree. Thanks. Yeah.
I really
Thank you very
appreciate
much.
it. And look at our friend Jim, who's watching from New Jersey, says thank you, Dr. Chudnoff and Dr. Ateghang. How wonderful is that? He's also got a heart. So we'll leave you with that. Now, one of the funny things I'm going to do is after I say goodbye is I reintroduce you. The reason is when you do shows like this, people are joining at different times. And when they join it again, they're not really sure what they're watching. And I want to entice them to stay and watch the whole thing again. So I'm going to, because the replay will start on Facebook, Twitter, LinkedIn, and YouTube. So the best way to follow my shows, please subscribe on YouTube, youtube.com/sreenet, and you can see my shows there. We'll thank our doctors, let them leave, and I will reintroduce them as they go. Great discussion. Thank you again from Queens, New York, says Marissa. Thank you very much. Bye, doctor, and bye, doctor.
Bye.
Bye. Amazing, amazing. Another amazing evening, and a credit to all of you, not to me. None of this has to do with me. This is you folks. You all participating, you all sharing, you all making it a point to share your love with all of us. I'm so grateful to all of you. Thank you very much. I am going to reintroduce our guests so that if you're watching now and you're wondering what you just saw or what you missed, this is our 40th straight session. Ask the Doctors. 40 days I've been on the air, and we just met Dr. Bernadette Ateghang, who was with us from 1 a.m. to 2:30 a.m. In Germany, and Scott Chudnoff, MD, OBGYN chair of Stamford Health in Stamford, Connecticut. Both of them together. I was so grateful to them for their energy, for their insights, for their wisdom. And thank you so much to both of you for being with us. I also want to thank our sponsor, and that's the Girl Scouts of Greater New York. We're so grateful to them. Please make a donation right now. If you found the show helpful in any way, go to bit.ly/gscookies1, bit.ly/gscookies1, or just email me and I'll tell you how. Make even one simple donation, but your money will go to pay for cookies that go to healthcare workers. Amazing initiative of the Girl Scouts of Greater New York. Please donate. And the ad for this has come from a third-party donor. We're so grateful to the donor for doing that. That means that the money for this ad did not come out of the pockets of the Girl Scouts or the hospital. This is how inexpensive our ads are. Maybe you have a nonprofit. Maybe you have a small business you want to give a shout out to. Maybe your local restaurant. It doesn't matter. Or you want to do a marriage proposal. Happy birthday. All of those we can do on this show. Please email me, sree@sree.net. Take a screen grab, anything so that you can find this again. I would be happy to run your ad. All that money will go to help our producers so that they can help me make the show. How can you also learn about the show? Follow me on YouTube. Subscribe on YouTube. My smallest channel is YouTube. I want to learn how to grow it. That's what I'm working on this season, this COVID season. So I'm working on that. I encourage you to work on things. We had a great Twitter tutorial yesterday. So if you go to youtube.com/sreenet, hit subscribe. I will learn as I go here. I will share what I learn. And then we have this. This is a WhatsApp QR code, not to be added to a WhatsApp group, but instead to be added to an alert. And you'll get a WhatsApp message when I'm going live. And I want to tell you about a couple of amazing shows I have coming up, not just on this show, but a couple of other ways I'm going to be live this week. So point your iPhone camera at the screen or your Android camera with a QR code reader, and you will be able to get an alert to come onto my show or know when my show is live. We also want you to come on our show if you have a guest idea. We'd love that. Here's our phone number for my WhatsApp so that you can text me and I'll add you to our WhatsApp group, or email me, sree@sree.net. I'm so happy to be with all of you here today. And I'm going to tell you about these other shows. You're going to be so amazed. Tomorrow at 11 a.m. Eastern to talk about everything that's going on in Washington, everything going on in the United States, everything going on in India, and with immigration to the United States. I could think of no better guest to have for you than the former ambassador of the United States to India, Richard Verma. Rich is an amazing font of knowledge. He's the former ambassador of the United States to India. He's the vice chairman of the Asia Group. You will learn plenty from him tomorrow. We're live at 11 a.m. Eastern, at 8 a.m. Pacific, 3 p.m. GMT. So please join us for that. That'll take us into Wednesday. On Thursday morning at 6 a.m. Eastern, really early, I'm hosting a global conversation, not on this show, but on a much bigger platform for Stratford upon Avon. It's called Salute to Stratford. Why? It's the birthday of William Shakespeare. And I'm honored that I will be hosting, along with my team, a global conversation about Shakespeare, not on the show, but on the platforms of Shakespeare Birthplace Trust. And we'll have guests from the Royal Shakespeare Company and so many different, very special institutions in Stratford. They're all under lockdown, but we're going to come together and celebrate Shakespeare together. My father, who grew up in a small village in India, grew up to become an ambassador. His memoir is called, as you can see here, Words, 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 Adventures in Diplomacy. And that's taken from William Shakespeare, from Hamlet. The line is the line that is Polonius says, oops, let me see if I can show you this. It's too bright here, but here you go. Polonius says, "What do you read, my lord?" Hamlet, words, words, words. William Shakespeare, Hamlet, Act 2, Scene 2. My dad knows all of Shakespeare by heart, and I'm so honored to be hosting that session, and that's happening because of the love you've all shown to this show. So that is Thursday morning, 6 a.m. Eastern, a global birthday celebration and a celebration of Stratford upon Avon. And also among the people will be the principal, the headmaster of the school where Shakespeare went to school. And we'll also, where he's buried, the church where he's buried. So we're going to have this global conversation about a small town in England. Please join me for that. That's 6 a.m. Eastern time on Thursday. And then we will have a couple of hours later, we're going to go to Hong Kong University for my weekly show with Hong Kong University. We're going to have a music interlude. We're going to listen to some amazing music from Hong Kong University. And then my regular show is at 9 a.m. Eastern. We're going to meet the International Red Cross Red Crescent. What are they doing in this crisis? You're going to learn so much from them. And that's just Thursday. Friday night is dating, love, and relationships during COVID-19. And then that comes to Saturday. We have the Broadway, talk about Broadway and theater with Adam Green, who is the theater critic of Vogue magazine. So it's going to be amazing, but I need guest ideas. Please message me, sree@sree.net. Please thank our wonderful producers, Vandana Menon, Vandana_Menon, and Rose Horowitz at Rose Horowitz. Follow them, please. And thank you all for being here. I can't wait to see you again. Thank you for being part of this. Jonathan says, genuinely interesting. Thank you, Jonathan, for saying that. And also the birthday of Cervantes, he says, if memory serves. You, sir, would know that. It is, I believe, the 452nd birthday of the Bard of Avon, and we are so, so grateful. Thank you so much, everybody. Goodbye, goodbye, goodbye. We'll see you soon. Bye-bye.